Hi everybody, welcome to my talk today, tips to support trainee nursing associates during placements. And I thought it'd be really nice just to do a few talks bespoke for nursing associates, and there is another talk linked to supporting tips for newly registered nursing associates, and then another one on career pathways, whether you want to stay as a nursing associate for your development or look at topping up to other career pathways. So I hope they really help you. Do subscribe to my YouTube channel if you are interested in more free videos linked to career and development for nurses and support. And do give me a like if you enjoyed the video, or put some comments in, and if you've got any questions at all, I'll answer all the questions. So I hope you enjoyed the session. So my first slide, that's me in the 1980s, and when I started out I did a training in a school of nursing. That's me with my hat on, and the key thing I wanted to say was placements can be hard, but keep going, you will get there. When I started my career I had a very bad experience on one placement where a mentor was shouting at me, and nowadays you would have much more escalation, etc. nowadays, but I nearly left nursing because of it, but I didn't, and you know, I would have missed out on this amazing career. So it can be hard, it's difficult going to different placements, meeting new people, you know, access support, talk to your tutors, talk to your practice supervisor, talk to each other, but try and keep going and you will get there. So prior to placement, just some quick fire tips. Identify key people and how to contact them for support in your university and during placements. And also don't just have telephone numbers, have emails as well. So when you think about it in placement, you've got your placement structures, you've got your practice supervisor and your practice assessor. There'll be a placement lead who will tell you where you're going to be going for your placement, and that might come from the university or from the employer. You've also got a university structure, so you're going to have an apprenticeship program lead who will be really supportive. You can ask them questions, and you might also have a personal tutor, and that might be your program lead, or it might be one of the tutors on the program. It depends how big your course is and how many people, how many students, how many trainee nursing associates you've got. Then you've also got your employer structure, so you're going to have your practice supervisor will work in an area where there's going to be a line manager, it might be a team leader, they might call it a deputy sister or a charge nurse, and after that there'll be a matron level, and you might have clinical educators or a lead nurse and an education lead. So find out who they are early on, have their emails and telephone numbers, so that if something goes wrong or you want to ask them for further advice or you've got a concern, you know, it could be a positive, it might be something, you know, looking at jobs maybe at the end of your course. But it's really helpful to have those key people. And if your practice supervisor goes off sick, who do you go to? So if you've got that structure in place, it's helpful. Next thing, prior to placement, so introducing yourself, contacting the placement area. Now, if it's your own area, because initially often you're doing your first proficiency sometimes in the area where you're working, so you've got your trainee nursing associate apprenticeship in an area, and for 2 days a week, for example, you might be working as a band 3 in that area. But when you're looking at your placements, if it's out of the area, you need to contact them and introduce yourself, and if you don't hear back, you might have to phone again or email them and escalate up to somebody else, your program lead. But if you're worried about what to say, I've got a little bit of narrative here. So hi, my name is Carol, I'm a trainee nursing associate due to start on oncology ward on next week. I'm contacting you to introduce myself and to request my rota, and I'm looking forward to meeting the staff, and you can contact me on this phone number. Don't forget to leave your contact details. I get contacted by so many people, students, trainee nursing associates, support workers, and if it's on email it's okay, but if it's telephone they don't always leave their contact details. So have an informal visit if you can before you go to the area. Try and arrange the informal visit, or you might even be invited to attend an informal visit by an educator, but to be proactive and try and arrange to go beforehand, because it will put your mind at rest. So on that phone call, when they phone back, you might say, oh, I'd really like to come and visit the area. Would that be convenient? And try and arrange it. Sorts of questions you're looking at prior to placement: obviously your shifts, changing room, staff room facilities, do you need a security pass, and the key team contacts. So as I said on the previous slide, try and get the emails and telephones. Really importantly, who do you contact if you're sick or unable to attend a placement? And that's so helpful, because you might be, ideally you won't be sick your first day, but if you were, how do you contact the area? Because you want to give a good impression when you start as a trainee nursing associate, because you're going to be signed off on professionalism, for example, and on your professional reviews. You might want to check on parking. Is there a parking permit? Have they got lockers? Never bring in anything, obviously, that's, that's expensive or that's valuable, but anything else that you're worried about. And if your placement area is off-site and in another hospital or in the community setting, you might want to check your travel, your logistics, and how to get there, and do a trial run. If you are late for whatever reason, don't get really upset and worry. Just tell them why, because life throws these things at us, and sometimes these things can happen. So, but it's just letting them know and using the right way. And often employers have a specific phone number to ring and person to ring if you can't make it, because you don't want your practice supervisor waiting in handover for you to turn up. Uniform, check the local uniform policy. Again, that's going to link to professionalism. Check if it's a tunic and trousers. If it's in theatres, it might be scrubs. And you might wear your own clothes if you're a mental health, if working with a mental health team and you're going out in the community. Sometimes the uniform might be a barrier between you and a patient. So check out the local uniform policy, because it may be different to where you're based originally as a with your employer. As a band 3, for example, it might be a different uniform, and you can check your washing temperature guidance on the uniform policy. And the main thing with uniform is to prevent transmission of infection. No false nails or nail varnish, because it can flake off, and if you're doing a wound, the nail varnish or a nail can even go into a wound, and sometimes you have very deep wounds to dress. And lanyards, when you're doing direct care activities, so the lanyard goes around your neck sometimes and you've got your badge, it can have infection on it, and they're not really washable. So they're wipeable, but not usually very washable. You would not have them when you go and do direct care activities, because they harbour germs, and also they can be quite dangerous, because if you've got something around your neck and you're looking after a patient with dementia, for example, they can pull like this and hurt your neck. So the other thing to think about is public perceptions when you're in uniform. No smoking in uniform, and don't wear your uniform when shopping, because the public perceive there to be infection risk, and so just, it'll be part of your uniform policy as well. Prior to placement, I'm often asked about pre-reading, and you're not expected to know everything, but you should have read around the specialist area, the topic area a little bit before you start. So if you were going to a respiratory unit, you might read a bit of anatomy and physiology around the respiratory function, for example, and the kind of tests that you do for somebody who might have asthma or chronic obstructive airway disease. Just a little bit of reading around that is really useful, and it'll impress your practice supervisors. And the NMC code is really good to read around: confidentiality, accountability. And ask staff and student forums for advice to direct your reading as well. So sometimes there's lots of Facebook forums and somebody might say, I'm going to a stroke unit, what sort of reading shall I do? And you'll get lots of experienced nurses and students advising on some reading. Get your books out of the library. Don't go buying books unless it's a really key text and you really think it's useful for the whole of your course. I've still got a lot of my textbooks actually from when I started, and I still look back sometimes at some of them. So some of them will last for years. Often they'll go out of date, but there's anatomy and physiology doesn't go out of date. So the British National Formulary is the handbook for medications, and there's a really good free mobile app that you can download. I think it's from the National Institute of Clinical Excellence where you download it, but don't quote me on that. But there is a free mobile app, and that's really helpful for medications because you have this handbook that every year is updated, and if you go on the mobile app, it's continually updated, so it'll never be out of date, and it gets updated every year, and it'll have all the side effects, the types of drugs, the and if drugs are withdrawn, that's why it's updated every year. You've also got clinical skills online that your universities will give you links for, and use the librarians as well. So there'll be online library links. Many employers are linked to Open University and library links. So do check with the employer if you've got access to that on their employer intranet sites, because it's helpful if you've got a spare half an hour or your practice supervisor suddenly's got the bleep for the hospital or for a floor, you can do some reading and go and have a look at library work as well. What to bring on your first day. So you've got black and navy shoes that are wipeable. You should have soft-soled shoes so they don't make a noise. You're not clacking down a ward area, waking patients up. And your feet should be enclosed for safety. For example, if you're drawing medication up and a needle fell on your croc and there's a hole in there, you know, it's not safe. Uniform, clean and tidy, short nails. So nails, if you look at your nails like this, they shouldn't be above the tops of your fingers. And that's because when you're doing manual handling with patients, you potentially can hurt them with scratching them with your nails. And if some people are on steroids, for example, their skin will be thin. So it's very easy to cause pressure sores just starting with a scratch, and it can get infected. Hair should be tied up off your collar. You should be bare below the elbows, and piercings usually are simple studs and no rings except your wedding ring. And as I said, look at the uniform policy. Other bits, black pens, don't get expensive black pens. You'll lose so many and you get asked, have you got a pen? So and don't have fountain pens because the ink can smudge. Black is standard for all medical professionals as black ink on records, photocopies well. You can bring food and fluid in, usually for break time. Make sure you sustain yourself so you're not getting faint on a shift. Water bottles, you should have access to water in the area. There should be hot food in the day. Usually the canteens should be open, or they should have access to food. But if they haven't for whatever reason, or you might be out in the community, you might need to bring little snacks with you, and a lunch or an evening snack or meal. And then you've got hand sanitizers and cream, as sometimes your hands can get sore. I know when I started in nursing, we used to have these big tubs of pink soap, and it used to make my hands so dry. I used to wash them so regularly. So you know, that's really helpful. And again, employers often will have hand cream next to the hand sanitizers and to the soaps that are in practice. So what to bring on my first day? So fob watch, you can't wear a wristwatch due to pathogens that may be on your wrist, and a pen torch you might want to bring. And employers should provide pen torches. So you use a pen torch to assess somebody's neurological status by shining the torch in their eyes. But there is the pen torches are quite cheap, often the ones that are used, and they don't have batteries in. So sometimes students want to go out and buy a pen torch, especially if you're on nights, you can use the pen torch as well. So you don't need to buy one though. employer should provide one. A notebook to write medical, nursing terms and your calendar for shifts. And sometimes you might have a digital calendar. What you must remember is not to put anything that's identifiable relating to patients that you're caring for in notebooks. You could accidentally drop a notebook or leave one in a canteen, for example, and you would be breaching confidentiality if that was reported. And we have also moved over to electronic patient records, so we're going paperless. And if you do have, you are in placement in an area that still has paper handover sheets, they must be shredded and disposed of before you leave the area, again for confidentiality. And you will have policies, local policies relating to all of this. So first day, what to expect. So be punctual, aim for 20 to 30 minutes before your shift. And I know that sounds like a lot, but if it's your first shift, you're going to meet people in the changing rooms, you're going to orientate yourself, you can put your food in the cupboard, but saying hi to people is really helpful because they will, you know, they'll know it's your first day then, and they'll say, oh, don't worry, come with me, we'll introduce you, because it can be quite daunting in handovers, and the NHS and health and social care is pressurised at the moment, so it can be quite stressful sometimes in handovers, and there could be, your practice supervisor might be finding it quite challenging that day. So being there a bit early is a bit more relaxed, and it's helpful for all parties really. Be proactive. If you do get there just as handover starting, for example, do introduce yourself if others don't introduce you. And as I said, being early helps with that as well. And the handover is usually quite specific to the field. You might have a digital handover. They might do it as an audio. I've seen audio handovers before as well, and they might put up a big whiteboard and go through each patient. So it depends on that speciality and field. Some tips now during placement. Don't try to do too much because you're going to be led by your practice supervisor and the team. So although I said to do a bit of reading, don't go overboard. You are going to feel tired. You've got all of your assignments to get used to doing, and you need to look after yourself. And during placements, don't overcommit during placements. And you might find some placements you really enjoy and some you find really challenging. Don't be afraid, to ask questions. Just try and ask them at the right time. So if somebody's looking very poorly and your practice supervisor's there trying to, I don't know, they might have a tracheostomy and they're about to suction, that is not the appropriate time necessarily. If somebody's coughing and choking, so choose your time wisely as well. Observe, listen and be proactive are the three key tips really. Sign off on your proficiencies are really important. So if you are consistently late, you are not going to be signed off for professionalism, for example, until you show that you can be on time. And your reviews are going to have potentially on there that you have not been on time to work, for example. And or if you keep using your mobile phone and sitting at the desk using your mobile phone, you know, there's lots of ways that you can be unprofessional. So NMC 6 platforms of proficiency for nursing associates. So your proficiencies are going to be linked to those 6 platforms and the apprenticeship standards for a nursing associate. So you can have a look at those. That's quite helpful if you're early on in your course. And bring in your practice assessment document, your ePad, whatever the university calls it, for sign off. And you might have a paper copy or you might have electronic copies, but it's quite handy to have a paper copy of your proficiencies for your practice supervisor. And especially if you can't get access to a computer, it's helpful at the end of the day or the shift or in your review to have a paper copy as well. Or you might just both sit at the computer, whatever works for you and your practice supervisor and assessors in that area. I just flicked a bit too quick then. I did mean to say as well to book your review dates early on. So when you've got your initial review, get your calendars out and put them in. You might change them later, but put them in so that they're there, and they'll prompt you and your practice assessor to do the midway and the end review as well. So some other tips to help your learning. What's really helpful is to use a person-centered approach to focus your learning. And when you come to an area, placement area, you can feel so overwhelmed and you think, oh, I need to learn every single condition that's in this area, every single treatment, every medication. You can't do it all. And I used to say when I was a nursing sister, just focus on what you've done that week. So if you've looked after 2 or 3 patients, you're on a stroke rehabilitation ward, for example. Oh no, let's not go with stroke, let's go for a neuroscience ward, and you've looked after 2 or 3 patients with epilepsy, then focus on epilepsy that week and look at the anatomy and physiology of what causes seizures. Look at the types of anticonvulsants that patients can be given. Look at the tests that we do. We do an electroencephalography. What does that do? That's measuring the electrical activity of the brain. And also look at a holistic person-centered approach. So how do the patient have seizures? Do they have, because there's a classification for seizures. What types of seizures do they have? Do they have an aura? How does it affect them psychologically, socially? And all of that, you need to talk to your patient. So sit down, talk to your patient. And if you do that, I guarantee it'll slow your learning down, but you'll remember it. And I remember patients that I nursed right from the start because I'd sit and listen to their stories and listen to how an illness had affected them. And it really helped my learning. And it's a great way to learn, to just be led by your patients. Another key tip is to review patient leaflets in the area, because they use simple language and they're easy to understand. And if your patient that you're looking after that day with your practice supervisor is going for an MRI scan, for example, you can download the NHS information about MRI scans, and there's also patient information leaflets. So you can, if a patient says, oh, I'm a bit worried about this MRI scan, what happens? You can say, oh, don't worry, you can get your leaflet and you can talk through the leaflet with the patient. So you're helping your learning and you're helping the patient. And it will have things like, it sounds like a sledgehammer, it's very, very noisy. And it's preparing your patient, but it's really helpful to look at patient leaflets, look at standardized care plans, look at the resources on the area. There may be different people that can help you, but there might be resource packs relating to different conditions, or it depends what area you're in. Talk to your pharmacist as well. They can give you printouts of regular medications as well. And if you get any spare time, it's helpful to bring in some key reading as well, some articles, for example, because your practice supervisor may suddenly have to whiz off, transfer a patient, or they might have to leave the area for some reason. They might have to take a bleep, for example. Now, they might allocate you to someone else, and and you'll be learning, still doing your practice, but there may be odd times where you do have to, there's nobody there to support you, to supervise you with a patient, that they say, look, go into the quiet day room and go and do some reading. I'll give you a bit of extra time here to do some reading and reflect on what we've done this morning. And it's helpful sometimes to have some key reading with you. Other opportunities, potentially access local resources. You might have online libraries, as I mentioned earlier. You might have staff study days that are open to students, and be proactive and say, there's I hear that there's a study day on falls prevention for the staff that's free. Would I be allowed to attend, because I've got a real interest in that? And that's fantastic to get access to those study days. So don't be shy, put yourself out there. They can only say no, and and that's fine, but at least you've tried. And if you can get access, that's wonderful. The employers will have intranet sites, and they will have document stores for key policies and guidelines. So it's helpful to look at the risk assessments, patient risk assessments, and also there may be patient information leaflets on those document stores or in those document stores. It's helpful to talk to specialist nurses and advanced nurse practitioners, clinical educators, allied health professionals, other students, and especially if you're looking at topping up later, it might be that you get inspired by a specialist nurse or advanced nurse practitioner. You want to do some shadow shifts with them. So do get out there and talk to people about their roles. Always, always ask for help if you're struggling. Always let someone know. So as I said earlier, the importance of knowing what your structure is in university and in placement, because staff are there to help you. And as I said, look at my previous slide for some of those structures and names and find out who the contacts are in your area when you're in placement. Always access support and always prioritise your physical and mental health. That comes before work, it comes before studies. Always prioritise your health. Use calendar time to book time off. You need downtime, and it can be really intense when you're trying to balance your shift work in placements with your university work. So having a calendar to book time off, but also to start planning assignments as early in advance as possible, but break them into chunks. Sometimes when you think, I've got a 2,000 word assignment, reflective essay, it seems so daunting. But if you think, right, I'm going to get a plan to my tutor within the first 3 weeks on a page of A4, or just an email to them on what my topic's going to be, and write your introduction. You don't need references for that. It gets you started, and it's by breaking it down into smaller chunks that it will really help you, that you're not leaving it all to the last minute. Request extensions due to mitigating circumstances sooner rather than later. So if you find that you've had quite a lot of sick and you're thinking, oh, I'll be okay, you're hedging your bets, you're thinking, well, I think I'll get through it, I'll be fine. And then you get to a week before the end of placement, you haven't got enough proficiencies signed off, you've got assignments due, and then you go and ask for an extension, and your tutor might be away that week, for example. It's harder. So it's always best to have the extension in place, and you might not use it, but you've got it in place. And you know, if you've got, you will get extensions if you've been poorly, for example. So do apply for them sooner rather than later. And you know, you are balancing those assignments, and it's really helpful to, because sometimes when you're in placement, you think more of the students will ring in sick, but they won't tell their personal tutors at uni that they've been ill, and then the tutor finds out quite late. So do find out the process in university as well as in placement. Asking for help and support, there is an escalation that you can do. So if you've had something that's happened in practice, or your practice supervisor's not there to give you your rota, who do you go to? You've got your practice assessor, and as I said, it's going up that escalation pathway. So clinical team leaders, your managers, the matron, the head of education. In university, they're the sort of practice people. In university, it might be the learning environment lead, the university placement lead, who might be linked to the area, your employer, but you might also have a university placement lead, personal tutor, and then you can go, if it's to do with your coursework, for example, it could be your program director or head of school, and then you've got a university dean. And usually things will be resolved right at the early level, but if people are off, or if it's something that's really distressing you and it's not been resolved, keep going. You have a right to keep going up that chain for support. If you get no resolution, which is very unusual, and you've gone through all those pathways, you can go to your NHS Quality and Standard team. So for example, in England, we've got Health Education England regional leads that you can talk to, and their emails according to different regions in England, and in Scotland and Wales and Northern Ireland, you'll have leads as well. So finally, enjoy and make the most of being a trainee nursing associate on placement. It's interesting, and don't forget to make the best, be proactive, access support, and I really hope you enjoy your placements. Final message, keep connected with other students and all those people I've just talked about who are there to support you. Let me know how you're getting on your nursing associate courses, trainee nursing associate courses, how you're getting on in practice. I wish you every success in your career, whether you stay as a nursing associate or choose to top up, whichever career direction you take. Good luck. We need you. We need nursing associates, and I wish you every success in the future. If you do want to contact me out of YouTube and put questions in the YouTube channel, I've got a website. You can link to me on Twitter and Instagram as well.